By the end of 2019, a pneumonia outbreak of unknown etiology was seen in Wuhan. It is June 2020 now and we're still dealing with it. We still don't know the etiology. There's new information available all the time. And this could also be called an infodemic with the amount of information that we are being bombarded with. So this automatically creates a lot of panic for the patient, because now you have to go to a clinic which is also visited by other patients, and you as a patient you are right to worry about if you contract the disease in such a place. It can happen to you. You can contract the disease while going to the clinic or at the place. So it's normal to feel anxious to go to a clinic. It is also scary for the dentist. As a dental practitioner, you are at high risk for corona. So I understand as a patient you're anxious, but when you have pain, you have to go. So let me tell you some tips in which you as a patient can be at a lower risk of contracting any kind of viral disease through aerosol transmission or through contact. Let me help you how you can do that. The biggest problem in any dental treatment is aerosol production. Now this aerosol production is the small water droplets which is in the air because of this high air rotor we use. Now in the air it can stay for up to even 3 hours. So this is what we are worried about as a patient and as a dentist as well, because although a patient can come and go, we are with that same virus 3 hours even. It could be as simple as a dental scaling, that is a dental cleaning or a crown preparation, but aerosols do happen. Now these aerosols, they start to recirculate with the air conditioner, and this being India, in June in Delhi, it is hot and it is hard to work without an air conditioning. So there are ways in which we as a dentist can schedule the patient at the last. The last appointment is usually a high risk patient who has COVID like symptoms. It could be flu, it could be fever, whatever it is. If he has symptoms, we can't deny treatment. We have to schedule the appointment in such a way that it is the last appointment, and you as a dentist are safe as well, and also the patient doesn't infect other patients who follow after him or even in the waiting room. Dentists are at a high risk for COVID. Just look at this chart. So all the green circles are healthcare professionals. If you see by risk, the highest risk are dentists, nurses, and dental assistants. This is because we are literally staring into a barrel of a gun. We are protected with our PPE kits, with our face shields, and our N95 masks. But if we do an aerosol procedure on any patient with COVID, like I said, the aerosol produced starts to recirculate and can infect others. So it is always the last appointment to be scheduled. And if you as a patient have flu-like symptoms, please inform the doctor. It is okay to have flu-like symptoms. It is okay to have a viral infection. But as a courtesy for your other patients in the waiting room and the doctor and his staff, please write it on the form. The dentist will ask you about it, or he'll have a form in which you'll have to tick some signs, and just please tell him your signs, or if you have flu-like symptoms, fever, cough, whatever it is, it's okay. So as a patient, number one, always go with an appointment. If you go with an appointment, it is easy for the doctor to place you. You get an appointment in which there are no other patients. You don't meet anybody. You just go in, get your treatment done in that scheduled slot, and move out. And we schedule it in such a way that there is no or very little interaction with any other patient. Always wear a mask. We've been lucky to have great patients who always have a social responsibility to wear a mask. It does prevent accidental transmission, and I've had really nice incidents where patients have told us, have complained to the other patients in the waiting room that you're not wearing a mask, and that is social responsibility. And it is beautiful that there are patients who are telling other people to wear their mask. Wearing a mask on the chin is not wearing a mask properly. You have to wear it properly. If there are more patients, it is better to wait outside. Go in, check in at the reception, and tell them, I'm here for my appointment. I will wait outside. Here's my number. Call me when the doctor gets free. I will walk in. That is the best way. We here in our clinic, we have 2 separate couches. Usually it is, we have 3 in one and 2 in the other, but now we keep 1 in each just to maintain some distance. So maintain distance even in the waiting room. Number 3, always sanitize your hands as soon as you enter a clinic, and do not touch your personal belongings like your phone and your purse, because quite possibly these are the most contaminated objects you are carrying around every day. So as soon as you enter a clinic, sanitize your hands and do not touch any personal belongings. If you have COVID-like symptoms, it's okay to tell the doctor. He will still treat you. He might have to reschedule you or see if the treatment is an emergency and then treat you, but he will treat you. Be a responsible citizen. Be socially aware. Be courteous towards other patients in the waiting room and also your dentist and his staff. Because if you don't, you are really putting your doctor at risk more so than anybody else, and his dental staff, and also the patients in the waiting room with you. As a dental office, we always call you a day before to ask you if you have any flu-like symptoms, and if you do have flu-like symptoms, and then we determine what is the procedure you want. If is it an emergency procedure, do you have pain? If you have pain, or if it's an emergency procedure, we will treat you. So we will schedule an appointment in the end of the day, and that's how you get it done. Because at the end of the day, once you're done, you leave the clinic, the whole clinic is fumigated every day. So also you need to understand that you might have to wait a little longer in such cases, because we have to sterilize the clinic a little longer than usual. We are using UV light as well. Earlier we never used UV light. We just used to disinfect and scrub. But now we also use UV, so it takes 5 more minutes. You have to be a little patient as a patient. So yes, as a patient, you're anxious, but don't fall to fear. We cannot be in this end of the spectrum, always just at home, quarantined, not going out anywhere. Can we have a wedding in a Delhi metro? So we have to be somewhere in between and minimize our risk and yet live our life, because this virus, I don't feel, is going away anytime soon. We in India right now, if you look at the graph, it's still going up, and I hope this is the peak, but it's hard to say where the peak is. Hopefully we reach it fast and we start to plateau and then taper off. But until then, you have to be very, very careful, because until the peak is established, our hospital system are still adjusting to accommodate new COVID patients. Even the best healthcare in the system in the US couldn't cope up with the number of COVID cases. So in a place like India, it is definitely difficult. There's not much the government can do. They've done a lockdown. That is the best they can do. After which, it is the responsibility of the citizen to maintain social distancing and be aware. This is all the government can do. It is debatable how effective it is, but one thing the lockdown has achieved is at least awareness about the disease, and the whole strata knows what COVID is. That is a good thing, but now we need to act on it, and we as people have to come together and stay 6 feet apart.